Over 15 million Americans pop an omeprazole pill every single day to control their heartburn and acid reflux. But here's the terrifying truth that pharmaceutical companies don't want you to know. This seemingly harmless little purple pill could be silently destroying your kidneys, breaking your bones, and damaging your liver right now. If you or someone you love takes omeprazole, Prilosec, or any proton pump inhibitor, the next 10 minutes could literally save your life. What I'm about to reveal are 7 deadly side effects that most doctors never fully explain, and some of them can kill you within weeks of taking your first dose. Omeprazole, also known by the brand name Prilosec, is one of the most popular acid-blocking medications on the planet. Millions of people worldwide rely on this purple pill to stop painful heartburn, heal stomach ulcers, and control dangerous acid reflux that keeps them awake at night. Doctors prescribe it like candy because it works incredibly well at shutting off your stomach's acid production. For many people, it's been a miracle drug that gave them their life back. But here's what's absolutely shocking. While omeprazole is busy protecting your stomach, it could be quietly attacking other vital organs in your body. The FDA has issued multiple warnings about serious side effects that can develop after just a few months of use, yet millions of people have no idea they're putting themselves at risk. Today, we're going to expose 7 dangerous side effects that are so serious, they could land you in the emergency room or worse. By the end of this video, you'll know exactly what warning signs to watch for and when to call 911. This information isn't meant to scare you away from necessary medication but to arm you with knowledge that could prevent a medical disaster. 1. Severe kidney damage. Meet David, a 52-year-old construction worker who had been taking omeprazole for 6 months to control his acid reflux. Everything seemed fine until he noticed he wasn't urinating as much as usual. Within 2 weeks, his hands and feet were so swollen he couldn't put on his work boots. David's kidneys were shutting down, and he had no idea that his daily heartburn pill was the culprit. This is the terrifying reality of omeprazole-induced kidney damage. It strikes silently and can destroy your kidneys before you even realize something's wrong. Your kidneys work around the clock to filter waste from your blood, but omeprazole can trigger a condition called acute interstitial nephritis, where your kidney tissue becomes inflamed and damaged. The scary part is that this can happen to anyone, at any time, even if you've been taking the medication for years without problems. The first warning sign is often a dramatic decrease in how much you're urinating. If you normally go to the bathroom 6 times a day and suddenly you're only going twice, your kidneys are crying out for help. Your urine might become darker or foamy, almost like beer or cola. Some people notice swelling that starts in their ankles and feet, then creeps up their legs to their hands and face. This swelling isn't just uncomfortable, it's our body desperately trying to deal with fluid that your damaged kidneys can't process. The most frightening part is how quickly acute kidney injury can progress to complete kidney failure. Some patients go from normal kidney function to needing emergency dialysis in just a matter of days. If you notice decreased urination, unusual swelling, extreme fatigue, or confusion, don't wait for your next doctor's appointment. Get to an emergency room immediately. Blood tests can quickly determine if your kidneys are failing, but every hour of delay could mean permanent damage to these vital organs that you can't live without. 2. Dangerous bone fractures. Barbara was a healthy 68-year-old grandmother who loved gardening and playing with her grandchildren. She'd been taking omeprazole for 3 years to manage her heartburn, never suspecting it was quietly stealing calcium from her bones. One morning, she simply stepped off a curb wrong and heard a horrifying crack. Her hip had snapped like a dry twig, requiring emergency surgery and months of painful recovery. Barbara's story isn't unique. Thousands of people on omeprazole are walking around with bones so weak they could fracture at any moment. Here's the shocking science behind this side effect. Your stomach acid isn't just there to digest food, it's also crucial for absorbing calcium from your diet. When omeprazole shuts down your acid production, your body can't absorb enough calcium to keep your bones strong. It's like trying to build a house while someone keeps stealing your bricks. The FDA has issued multiple warnings about this side effect, particularly for people who take omeprazole for longer than a year. Women over 50 are especially vulnerable because they're already at higher risk for osteoporosis. But here's what's truly terrifying. your ones can become dangerously weak without any warning signs. You might feel perfectly fine one day and suffer a devastating fracture the next. Hip fractures are the most dangerous because they often require major surgery and can lead to life-threatening complications. Spine fractures can happen just from coughing or bending over to pick up something light. Even wrist fractures from minor falls can signal that your bones are in serious trouble. The worst part is that once omeprazole has weakened your bones, the damage can be permanent. Some studies show that even after stopping the medication, it can take years for bone density to improve, if it improves at all. If you've been taking omeprazole for more than a year, especially if you're over 50, ask your doctor about a bone density test. Watch for warning signs like back pain, loss of height, or fractures from minor injuries. Don't ignore these symptoms. You'll be your bones literally crying for help. 3. Severe magnesium deficiency. Jennifer was driving to work when her hands suddenly started cramping so badly she had to pull over. Her heart began racing erratically, skipping beats and pounding in her chest. By the time paramedics arrived, she was having full-body muscle spasms and could barely speak coherently. Jennifer was experiencing severe magnesium deficiency caused by her daily omeprazole pill, a condition so dangerous it can trigger seizures, heart attacks, and even death. Magnesium is one of the most important minerals in your body, controlling over 300 different biochemical reactions. Your heart, muscles, and nervous system literally cannot function without adequate magnesium levels. But here's the terrifying part. Omeprazole can quietly drain your magnesium stores over months or years, and by the time symptoms appear, you could already be in a life-threatening situation. The early warning signs are often dismissed as stress or aging. You might notice muscle twitches, especially in your eyelids or legs. Your hands might start cramping during simple tasks like writing or typing. Some people experience restless leg syndrome or have trouble sleeping because their muscles won't relax. But as magnesium levels continue to drop, the symptoms become terrifying. Your heart rhythm can become dangerously irregular, causing palpitations, chest pain, or even cardiac arrest. Muscle spasms can progress to full-body seizures that require emergency medical intervention. Some patients become confused, disoriented, or develop severe personality changes as their nervous system begins to malfunction. What makes this side effect particularly dangerous is how it can mimic other serious conditions. Heart rhythm problems might be mistaken for a heart attack. Muscle spasms could be dismissed as anxiety or panic attacks. Confusion might be attributed to stress or depression. Meanwhile, your magnesium levels continue to plummet toward life-threatening levels. The most frightening cases involve people who have sudden cardiac arrest with no warning. Their hearts simply stop beating normally because there isn't enough magnesium to maintain proper electrical conduction. If you've been taking omeprazole for more than 3 months and experience muscle cramps, heart palpitations, weakness, or confusion, demand a magnesium blood test immediately. Don't let doctors dismiss these symptoms as stress or anxiety. Your life could depend on getting the right diagnosis quickly. 4. Liver damage and failure. Michael was a 45-year-old accountant who prided himself on staying healthy. He'd been taking omeprazole for 8 months when his wife noticed something alarming. The whites of his eyes had turned yellow. Within days, Michael's skin took on a sickly golden hue, and he was so exhausted he could barely get out of bed. Blood tests revealed that his liver was severely damaged, and doctors weren't sure if he would need an emergency transplant. Michael had no idea that his heartburn medication could destroy the very organ that keeps his body functioning. Your liver is your body's chemical processing plant, working 24 hours a day to filter toxins, produce essential proteins, and store energy. When omeprazole triggers liver damage, it's like throwing a wrench into the most important factory in your body. The terrifying part is that liver damage often develops silently, with no warning signs until the damage is already severe. The first visible sign is usually jaundice, the yellowing of your skin and eyes that happens when your damaged liver can't process waste products properly. But by the time jaundice appears, your liver function may already be critically compromised. Along with the yellowing comes extreme fatigue that sleep can't fix. You might feel exhausted after simple tasks like walking upstairs or even showering. Your urine becomes dark brown or tea-colored, while your stools turn pale or clay-colored. These color changes aren't cosmetic issues, they're your liver sending out desperate distress signals. Some people experience severe pain in their upper right abdomen, right below the ribcage where the liver is located. This pain can be excruciating, often described as a constant, deep ache that gets worse when you breathe deeply or move around. Nausea and vomiting can become so severe that you can't keep food or even water down, leading to dangerous dehydration. What's truly terrifying is how rapidly omeprazole-induced liver damage can progress from mild injury to complete liver failure. Some patients go from feeling perfectly fine to needing emergency medical intervention within just a few weeks. Liver failure is often fatal without immediate treatment or transplantation. If you notice any yellowing of your skin or eyes, dark urine, pale stools, severe fatigue, or upper abdominal pain, stop taking omeprazole immediately and get to an emergency room. Your liver doesn't have pain receptors, so by the time you feel pain, the damage may already be life-threatening. 5. Serious allergic reactions. Karen had taken omeprazole without problems for 2 years. Then one Tuesday morning, within an hour of taking her usual pill, her lips began tingling and swelling. Her throat felt tight, and she could barely whisper. By the time her husband found her, Karen was struggling to breathe, and her entire face was swollen beyond recognition. She was experiencing anaphylaxis, the most dangerous allergic reaction your body can have, and she had less than 30 minutes to live without emergency treatment. What makes drug-induced anaphylaxis so terrifying is its unpredictability. You can take the same medication safely for months or even years, and then suddenly your immune system decides that omeprazole is a deadly threat. When this happens, your body launches an all-out attack that can kill you within minutes. The reaction often starts with seemingly minor symptoms that people tend to ignore. You might notice tingling or itching in your mouth, lips, or tongue. Your throat might feel scratchy or tight, like you're getting a cold. Some people develop hives, raised, TCHY welts that appear suddenly on their skin. But these early warning signs can rapidly escalate into a life-threatening emergency. Your throat and tongue can swell so much that your airway becomes completely blocked. Breathing becomes increasingly difficult, then impossible. Your blood pressure can plummet so fast that you lose consciousness within minutes. Your heart races desperately, trying to pump blood through your collapsing circulatory system. Some people describe feeling like they're dying, and unfortunately, they're right. Anaphylaxis can be fatal within 15 to 30 minutes without immediate treatment. The swelling can be so severe that you become unrecognizable. Your face, lips, and tongue can balloon to grotesque proportions. Your skin might break out in massive hives or turn strange colors. Some people develop severe stomach cramps, vomiting, and diarrhea as their entire digestive system goes into shock. What's particularly dangerous about omeprazole-induced anaphylaxis is that it can happen even if you've never had allergies before. Your first exposure to the medication might be perfectly fine, but subsequent doses could trigger a deadly reaction. If you experience any swelling of your face, lips, tongue, or throat after taking omeprazole, call 911 immediately. Don't wait to see if it gets better. Anaphylaxis can kill faster than help can arrive. EpiPens can buy you precious time. 6. Vitamin B12 deficiency. Patricia was a sharp 62-year-old retired teacher who prided herself on her excellent memory and quick wit. After 3 years on omeprazole, she began forgetting simple things like where she put her keys or what she had for breakfast. Her family initially joked about senior moments, but the memory problems rapidly got worse. Patricia started getting lost driving to familiar places, couldn't remember her grandchildren's names, and developed a painful, burning tongue that made eating unbearable. What Patricia didn't know was that omeprazole had slowly drained her body of vitamin B12, and the damage to her nervous system might be permanent. Vitamin B12 is absolutely crucial for your nervous system and brain function. Your body needs stomach acid to absorb B12 from food, but omeprazole shuts down acid production so completely that you can become severely deficient even if you eat a healthy diet. This deficiency doesn't happen overnight. It develops slowly over months or years, making it particularly insidious. The early symptoms are often dismissed as normal aging or stress. You might notice that you're more forgetful than usual, having trouble concentrating at work, or feeling unusually tired despite getting enough sleep. Some people develop a strange sensation of pins and needles in their hands and feet or notice that their balance isn't as good as it used to be. But as B12 deficiency progresses, the symptoms become truly frightening. Your memory problems can progress from mild forgetfulness to severe confusion that resembles dementia. Some people lose the ability to recognize family members or remember how to perform simple tasks they've done thousands of times. The tongue symptoms are particularly disturbing. It becomes red, swollen, and painful, making it difficult to eat or speak properly. The neurological damage can be devastating and potentially irreversible. Your peripheral nerves, which control sensation and movement in your arms and legs, can become permanently damaged. Some people develop severe weakness, numbness, or pain that never goes away, even after B12 levels are restored. In the worst cases, the damage to the brain and spinal cord can cause permanent disability. What makes this side effect particularly tragic is that it's completely preventable with regular B12 monitoring and supplementation. But many doctors don't check B12 levels in patients taking omeprazole long-term, so the deficiency goes undiagnosed until serious damage has already occurred. If you've been taking omeprazole for more than a year and notice memory problems, tongue pain, numbness in your hands or feet, or unusual fatigue, demand a B12 blood test immediately. Early detection and treatment can prevent permanent neurological damage. 7. Dangerous stomach infections. James was a healthy 58-year-old engineer who had been taking omeprazole for 2 years to control his acid reflux. One day, he developed what seemed like a simple case of diarrhea. Within 48 hours, James was having bloody, watery stools more than 20 times a day. He was rushed to the hospital severely dehydrated and fighting for his life against a C. diff infection that had turned his intestines into a war zone. James had no idea that his acid reflux medication had destroyed his gut's natural defenses, leaving him vulnerable to one of the most dangerous infections a person can get. Your stomach acid isn't just there to digest food, it's your first line of defense against dangerous bacteria, viruses, and parasites that you swallow every day. When omeprazole shuts down acid production, it's like disarming the security system that protects your digestive tract. Suddenly, harmful organisms that would normally be killed by your stomach acid can survive and multiply in your intestines. C. difficile, or C. diff, is one of the most terrifying infections that can take hold when your stomach acid is suppressed. This bacteria produces toxins that literally eat away at the lining of your colon, causing severe inflammation, bleeding, and sometimes death. The infection can be incredibly difficult to treat because C. diff is resistant to many antibiotics, and the damage to your intestinal lining can be extensive. The symptoms start innocuously enough: loose stools, mild abdominal cramping, and maybe a low-grade fever. But C. diff infections can rapidly spiral out of control. The diarrhea becomes explosive and bloody, occurring 15 to 20 times per day. The cramping becomes excruciating, like someone is stabbing you in the gut with a knife. Dehydration happens quickly because you're losing massive amounts of fluid and electrolytes. But C. diff isn't the only dangerous infection that omeprazole users face. The lack of stomach acid also increases your risk of pneumonia because bacteria that you normally swallow and destroy can travel up your esophagus and into your lungs. Some studies show that people on acid-suppressing medications have double the risk of developing pneumonia, which can be life-threatening, especially in older adults. The disruption of your gut bacteria also leaves you vulnerable to other serious infections like Salmonella and Campylobacter, which can cause severe food poisoning that requires hospitalization. What's particularly frightening is that these infections can be much more severe and harder to treat in people taking omeprazole because their natural immune defenses have been compromised. If you develop severe diarrhea, especially if it's bloody or accompanied by fever and abdominal pain, while taking omeprazole, get medical help immediately. Don't dismiss it as a stomach bug. It'll be a life-threatening infection that requires aggressive treatment. Now that you know about these 7 dangerous side effects, here's exactly what you need to do to protect yourself. First and most importantly, never stop taking omeprazole suddenly without talking to your doctor. Stopping abruptly can cause a dangerous rebound effect where your stomach produces massive amounts of acid, potentially causing severe ulcers or bleeding. Your doctor needs to create a tapering schedule that gradually reduces your dose over several weeks or months. Schedule an appointment with your doctor immediately to discuss your concerns and ask about alternatives. There are other medications like H2 blockers that might be safer for long-term use, or your doctor might recommend lifestyle changes that could eliminate your need for acid-suppressing drugs altogether. Demand regular monitoring if you must continue taking omeprazole. This should include blood tests to check your kidney function, liver enzymes, magnesium levels, and vitamin B12 every 6 months. Many doctors don't do this routine monitoring, but your health depends on catching problems early. Consider natural alternatives like dietary changes, weight loss, elevating the head of your bed, and avoiding trigger foods. Some people find that probiotics, digestive enzymes, or apple cider vinegar can help manage acid reflux without dangerous medications. Most importantly, trust your instincts. If you develop any of the warning signs we've discussed today, seek medical attention immediately. Your life is more important than worrying about bothering your doctor or seeming like a hypochondriac. Remember, omeprazole helps millions of people manage serious acid-related conditions, but knowledge is your best protection against these 7 dangerous side effects. Watch for kidney problems, bone fractures, magnesium deficiency, liver damage, allergic reactions, B12 deficiency, and serious infections. These aren't minor inconveniences, they're potentially life-threatening emergencies that require immediate medical attention. Share this video with anyone taking acid-suppressing medications because this information could save their life. Subscribe for more life-saving medical content, and remember, always consult your doctor before making any changes to your medications. Your health is worth fighting for.